Welcome. This is Technology, Organizations, and People, and I'm John Carlton-Foss. One of the things that happens in a highly technological society such as we have is that it takes a lot of fossil fuels to generate electricity and to move vehicles around in our society. That means that the fossil fuels put carbon into the atmosphere and the oceans, and this creates climate change or global warming. This in turn has medical impacts. Today we're going to have a presentation by Wendy Ring, MD and MPH. She's a member of Physicians for Social Responsibility. And I'll turn it over to Wendy now.
Thanks.
Thank you.
Well, as John mentioned, I'm a doctor, I'm a family physician, and I've been in practice for almost 30 years. And my interest in climate change, I think, began just as many of you as an ordinary citizen, but I become increasingly alarmed at the broad gap, the deep gap between what the scientists are telling us about what is happening and what needs to be done and the general public's understanding of that, and also of our political leaders. And it occurred to me that climate change is sort of like a chronic disease of the planet, which is something that doctors have some skill in caring for, and we're also very good at translating science into regular English. And so that's what brings me before you today. I'm going to act like a doctor and try to explain to you exactly what's going on with the climate and what that has to do with our health and what we need to do about it and how we can get it done. So, slide, please. The climate is clearly changing in our country. This is a picture that is familiar to any of you who are gardeners. It's what you get on the back of any of the seed packages, and tells you what you can grow in your location and when it's safe to plant it without a danger of frost. And this had to be revised this year because things have become so much warmer that almost everywhere in the country is at least a half zone warmer, and many locations are an entire zone warmer than they were back in 1990. We're also having hotter summers, and we've been tracking temperatures in the United States for 117 years, so anywhere that you see the red areas that say 117, that means that those were the hottest summers on record occurred in this past summer. And in addition, we're seeing heavier rainfall. When the temperatures are warmer, there's more evaporation of surface water, and there's less snow, so it comes down as rain, and not just sort of evenly distributed drizzles, but actually heavy rainfall. And you can see that that's increased quite a bit everywhere except in the part of the country that I come from in the Southwest, which is currently experiencing drought. And as I said, where it's not wet, it's too dry. And as of right now, about 60% of our country is experiencing moderate to severe drought conditions. So what does all of that mean for our health? I'm going to present some cases of some people who got sick and talk a little bit about why they became ill and what that has to do with the climate. So here's the first one. 72-year-old woman is taken to the emergency room by ambulance. A neighbor called because she's normally sharp but started acting confused. Up until that time, she'd been in good health, taking medication only for high blood pressure. And while she was in the ambulance, the paramedics report that she became increasingly agitated, and she had a seizure when she got to the emergency room. Her skin is hot and dry, and her temperature is 106. It happens to be July, and she's suffering from heat stroke. Heat waves kill more people in the United States than any other kind of extreme weather event. About 1,300 people a year die from extreme heat. Children, the elderly, and people who take certain kinds of medications like diuretics for blood pressure or antipsychotic medicines for mental illness are more vulnerable, as are people who work outdoors. This is especially a serious problem in the cities because of something called the urban heat island effect, which is simply that the cement and asphalt in the city absorb the heat and radiate it back, so that in a city center the temperature can be 9 degrees higher than it is in the surrounding suburbs. Heat waves can be lethal. And these are projections for the city of Chicago in the future. Back in 2003, there was a heat wave in Europe that killed 35,000 people. And in my state of California, back in 2006, we had 2 weeks of extreme heat that resulted in 600 deaths, 1,600 hospitalizations, and 16,000 additional visits to the emergency room. As I said, this is a prediction of death rates just for the city of Chicago in the future, and there are 2 columns for each of those future years. The yellow column, the lower emission scenario, is if we make significant differences in the our burning of fossil fuels, and the red column is if we continue business as usual. And you can see that the death rate is a lot higher if we don't make some big changes. It's predicted that in the future, due to climate change, there will be 8 times more days of extreme heat than what we're experiencing now, and on average, triple the number of deaths. The other important effect that increased heat has on our health is through our food, and it doesn't have to be extreme heat. Normally, when food is cooked, it can be left safely at room temperature for up to 2 hours. But if the temperature is above 90 degrees, then the amount of time that it's safe to be unrefrigerated is only 1 hour. And so when the temperature is warmer, we see increased rates of food poisoning. And about 1/3 of the salmonella cases in the U.S. are attributed to increased temperature. And I put seafood on that plate to remind me to talk also about the not just bacteria contaminating the food, but the effect that warm water has on food safety. Because when the water's warmer, we have more algae blooms like the red tide, and they create toxins that affect the human nervous system. And unfortunately, for bacterial food contamination, many kinds, if you cook the food well, then you don't get sick. But the toxins that the algae blooms create are heat stable, so you can cook the food until it's black and you would still get sick from the toxins. Here's another case presentation. A 54-year-old woman came to the emergency room with a 4-day history of fevers, rash, abdominal pain, nausea, vomiting, muscle aches, and headaches. She has difficulty speaking, is disoriented, and has weakness in her arms and legs. A week before she got sick, she found a dead crow in her yard. This is West Nile virus, and West Nile virus first appeared in the United States in 1999 in New York State. There were less than 100 cases. Within 4 years, it had spread across the country with a total of 10,000 cases. And West Nile virus is transmitted by mosquitoes, and climate has been implicated in the rapid spread of West Nile virus across the country. This year, 2012, has had the highest number of West Nile virus cases ever recorded in the U.S. The way that the climate affects the mosquitoes is that when the temperature is warmer, the breeding season of the mosquitoes is extended, so we get more mosquitoes. The time that it takes a baby mosquito to grow to its mature reproductive biting stage is shortened, and the multiplication of the virus that causes West Nile virus inside the mosquito is increased. So you get more mosquitoes who are more likely to bite, and when they bite, you're more likely to get the illness. And dengue fever is another mosquito-borne illness that we are seeing more of. We used to have this in the southern states a long time ago, but it was eradicated. But it's back, and since 1980, we've had 7 outbreaks in southern Texas, 1 outbreak in Hawaii, and 2 in southern Florida. And this slide depicts the some of the staff from the health department in Key West who were out to trap mosquitoes during an outbreak of dengue. U.S. hospitalizations for dengue tripled between 2000 and 2007. And the reason is partly because of all the things that I told you about the effects of warm weather on mosquitoes, but in addition, the mosquito that's most effective at transmitting dengue can't survive a freeze in the winter. And so as the temperatures in the wintertime get warmer, the range in which this mosquito can live expands. And the following slides show the return of dengue fever and predictions for the future about increased spread of dengue. So dengue is kind of like it's an illness with a fever and a flu-like illness the first time you get it. But it's important, particularly from a public health point of view, because if you are unlucky enough to get dengue fever the second time, it causes something called hemorrhagic fever, which is where it incites your own immune system to attack your body, and it's about 50% fatal. This is another insect, not a mosquito, commonly called the kissing bug, and it transmits a disease called Chagas disease. And it's called a kissing bug because it likes to bite the face. And when it bites the face, after it sucks your blood, it defecates, and the parasite goes from the feces of the insect through the bite hole and into the person. And this has been called the AIDS of the Americas. The similarity with AIDS being that the initial infection is not very symptomatic, it's not very dramatic. People often don't know that they've got it. But over time, the parasite attacks the heart, and about 30% of the people who are infected with Chagas go on to develop heart failure. So, and we have the insects that cause Chagas disease. They've been found in our southern states. And it had been thought that we were not at danger of Chagas disease here. It's mostly in Latin America. But that we weren't in danger of it here because the insects bite at night, and our housing is better than the housing in Latin America, so the bugs wouldn't be able to get in. But researchers have recently done surveys and looking and have found kissing bugs in Arizona and Texas that are carrying the parasite that causes Chagas disease, and about half of them were carrying the parasite, and about 40% of them had recently fed on humans. So the only theory now standing about why we are not seeing Chagas disease being contracted in the United States is and this was from a study that was done by a bug specialist who watched the bugs feed, and he concluded that the kissing bugs in Latin America go to the bathroom right after they finish eating, and the kissing bugs in North America were more polite, and they stepped away from the dinner table before they did their business. And so basically all that's standing in between us and an outbreak of this very serious disease is the bathroom habits of an insect. Displacement is another serious health consequence of climate change. Climate change is now the #1 cause of the dislocation of human populations in the world. More people are dislocated by climate change than by war or by genocide. And this is predicted to increase over the coming years. And this is important because it's not only insects that bring diseases, so when people are displaced from where they live, and if they come from poorer countries that have contagious diseases that aren't common here in the United States, they will bring them along. And of particular concern to the public health community in the United States is tuberculosis, which is about 12 times more common in immigrants to the U.S. than in native-born people. And especially of concern is a kind of tuberculosis called multiple drug-resistant tuberculosis. TB is a kind of infection that has to be treated for an extended period of time, and if the medication is interrupted, then the organism gets a chance to develop resistance to it, and then that medicine is no longer effective. And so there there are cases of tuberculosis where the medicines just don't work and people die because they're not able to be treated. About 80% of the cases of multiple drug-resistant tuberculosis in the United States are caused by immigrants who brought it with them from other countries. So, back to that one again, if you would. It won't go back. This is a photo actually from the United States, showing an evacuation center during an extreme weather event. And I have personal experience with the health problems resulting from displacement in the United States because I went with a team of people to help the refugees from Katrina. And surprisingly, the biggest health issue that we encountered was people with chronic diseases who had their care interrupted. And so, you know, we have many people in the United States who survive because of our complex healthcare system. And when they are cut off from that, they run out of their prescriptions, they don't have their dialysis, they can't see their specialist, they can become very ill. And so that is a lot of what we learned from Katrina about the health consequences of extreme weather events. Next case. A 10-year-old boy is brought to the doctor by his mother because of a persistent cough. Although he's always been very active and played both soccer and Little League, he now avoids exercise and spends most of his time in front of a computer. He missed 10 days of school this year because of illness and has had several visits to the emergency room for bronchitis. And, this unfortunate boy has asthma. And he comes from Bakersfield, California, which has the third worst air quality in the United States, and where 1 in every 6 children have asthma. And this is related to climate because our warming climate increases the levels of ozone in the air. And ozone is good when it's high up in the atmosphere protecting us from ultraviolet rays, but at ground level it's a severe irritant to the respiratory system. And so when ozone levels are high, we see lots of visits to the emergency room and hospital admissions for people who have lung problems like asthma and emphysema. Researchers have looked at 48 major cities in the U.S. and found that in the summertime, when the ozone levels go up, for every 10 part per billion increase in ozone, which is not much, and still under the level that's considered safe by the Environmental Protection Agency, but for every 10 part per billion increase, there's nearly 4,000 additional deaths. Long-term exposure to ozone also can cause lung damage. It's not just people who already have lung damage where the ozone makes it worse. And we know that children who play 3 or more outdoor sports in parts of the country that have high daytime levels of ozone are 3 times more likely to develop asthma than children who don't. And asthma rates in the U.S. have doubled since 1980, with the highest rates of asthma in the areas with the highest levels of ozone. Ozone is basically smog, and it forms when the air pollutants from exhaust and from the burning of fossil fuels combine in the presence of heat and sunlight. And so when there is more heat and more sunlight, you get more ozone. And we've done a lot of work in this country on trying to lower the release of those pollutants into the air, but we're not getting all the benefit that we should be because the increased temperatures are driving that ozone forming reaction faster. And so it's being called a climate penalty, that we're having higher levels of ozone than we would were it not for climate change. And it's predicted that in 2020 we'll see 3 million more cases of severe respiratory symptoms just due to the climate penalty, rising to 12 million by 2050. And it's also predicted that due to that climate penalty of increased ozone, we'll see a five-fold increase in hospitalizations of infants and elders due to respiratory illnesses. The fellow on the left there is Galen Rupp, and he's an Olympic athlete, um, and this is from the U.S. Olympic trials earlier this summer. He's wearing a mask because he has asthma, and the pollen levels were so high that he was afraid it would affect his performance. Carbon dioxide in the atmosphere acts as a fertilizer, more for weeds than for crops, unfortunately, and it dramatically increases pollen production. So the first two columns in the graph on the right are actual historical averages of pollen production, and the third column shows how much pollen is produced when a plant is grown under experimental conditions with levels of carbon dioxide in the air, such as we expect to see in 2075. Pollen is of great concern to people who suffer from allergies and asthma, and there are currently many days when weather stations will show an alert warning people who have those conditions to stay indoors and not exert themselves, and that is expected, the number of those days is expected to increase dramatically with climate change. Drought also has some significant health consequences. On the far left there, you see farmers in Texas who gathered in a public park last summer to pray for rain. And on the bottom right, you see their cattle who are emaciated due to lack of feed. But it's not only cows that go hungry when we have crop failure. Next slide, please. When crops fail, food prices go up, and this summer the commodity price of corn nearly tripled, and that doesn't translate exactly to what we see on the supermarket shelves. Generally speaking, under poor crop conditions, retail food prices may go up initially, maybe only 5%. The first things to go up in price are meat, poultry, and dairy products, and then over time prices can go up even as high as 10% and affect grain products as well. And this is important for the health of people in this country because we have about 48 million people in the United States who are food insecure, which means that they cannot be assured of having enough money to be able to put groceries on the table. And we have 1 million children who are very food insecure, which means that they sometimes go to school or go to bed hungry. And food insecurity has health consequences for children. We know that kids who come from families that are food insecure have 11 times higher rate of iron deficiency anemia in preschool, which drops to 8 times higher rate in elementary school and still persists at a 3 times higher rate even into high school. Iron deficiency anemia is important because that means a lack or a decreased amount of red blood cells, which is what carries oxygen to our brains. And so children that have anemia have difficulty with school performance and have lasting developmental deficits as a result. And unfortunately, even if we diagnose the anemia and treat it with prescription strength iron, it doesn't reverse the developmental damage. It's also not only a matter of not getting enough to eat, it's also a matter of getting the right kinds of food to eat. And we know from research that's been done on family buying habits, manipulating the relative prices of milk and soda, that when milk is less expensive, poor children get more milk. And when soda is more expensive, they get less soda. And it's pretty likely that if you flip that on its head and you make the milk more expensive, we're going to see a lot of low-income children drinking more soda instead. And that's why we have higher rates of obesity in children from families that are food insecure. The other consequence of drought, and particularly if, as predicted, drought persists in the Southwest, is dust storms. And we're starting to see some large dust storms in the Southwest. And we don't have a lot of data about the effect of dust storms on health in the U.S., but there has been a lot of research done in Asia where they're more common, and they see significant increases in hospital admissions for both heart and lung conditions for up to a month following dust storms. They have also done measures of lung function in children and shown deterioration of children's lung function after they've been exposed to dust storms. we have a problem in our Southwest with a fungal lung infection called coccidioidomycosis that is transmitted by breathing in dust. And preliminary numbers look like we're seeing increased rates of this lung fungus infection following large dust storms. And this is just showing a prediction based on weather modeling, which is the black line, and the actual number of cases of that lung fungus infection, and you can see that they match up pretty well. So when the weather is dry and then you have high winds, then people get more cases of lung infection. We are also seeing more wildfires, not just increased frequency, but increased size of wildfires. And in the western part of the country, this is, this is an annual inferno, pretty much, you could say. And climate change is predicted to increase the frequency of size of wildfires even more, quadrupling the area burned for each 1 degree rise in temperature. Wildfire smoke contains a lot of bad stuff, but the worst for your health are these very fine particles. They're called fine particulates, and they are easily inhaled into the respiratory system, and also some of them are so small that they can pass from the lungs into the bloodstream, causing inflammation. During and after large fires where we have high levels of particulates in the air, we see increased hospital admissions not only for lung-related problems like asthma, bronchitis, and pneumonia, but also for cardiovascular problems like strokes and heart attacks. And this is just from a study comparing two populations in North Carolina. The blue dot folks were exposed to smoke from a wildfire, and the white dot folks weren't, and you can see the increase in their hospital use for both asthma, chronic lung disease, pneumonia, and also heart attacks, heart failure, heart rhythm problems. Let's do another case. The Public Health Department was notified by schools and employers due to an unusually high rate of absenteeism. The sick students and workers reported fever, vomiting, diarrhea, and abdominal cramps lasting 1 to 2 weeks. By the time the cause was found and eliminated, over 400,000 people had become ill. And this is a true story from the United States. And this is a cryptosporidiosis outbreak that occurred in the city of Milwaukee during a period of record rainfall. Milwaukee gets its drinking water from Lake Michigan, and when there is more water coming down than the soil can absorb, then that water has to go somewhere. Oops, can we have the next slide? And the next one. The slide after that one. And where the water goes, either run off into large bodies of water like Lake Michigan, or through our sewer system, and then sometimes again into large bodies of water, or into our drinking water, unfortunately. There is a type of sewer system in the U.S. that we have in over 700 cities, and it's called combined sewer overflow. And what that means is that the same pipes that carry away our raw sewage are also supposed to carry away our rain runoff. But when we have heavy rains, they're easily overwhelmed, and the water has to come out somewhere. So the slide that I just showed was a warning sign posted by the City of New York, which says, "This outfall may discharge rainwater with untreated sewage during or following rainfall." And that's exactly what they do. It only takes a 1/4 of an inch of rain, 1/20th of an inch of rain in New York City to provoke the spilling of raw sewage into the rivers. And in Indianapolis, it only takes 1/4 of an inch of rain. So we know that more than half of the cases of drinking water contamination in urban watersheds occur during storm events, that after rainfall we see a tripling of hospital admission rates for children with diarrhea, and that nearly 70% of all outbreaks of gastroenteritis occur after heavy rain. So our water supply, the safety of our water supply is very vulnerable to the changes in climate. We also are going to be seeing more flooding as a result of rising sea levels. The sea level on the East Coast has been rising almost an inch a year since 1950 and is predicted to rise 1 foot by 2050 and 3 feet by 2100. This is both because of melting ice and also because the warming of the oceans, and that warm water takes up more room than cold water. The risk of coastal, what are called 100-year floods, are predicted to double to triple by 2030, with the potential to affect 5 million people living in coastal areas in the U.S. So we've been talking about people getting sick, and you may have noticed that I keep saying over and over again when I'm talking about who is getting sick, that it's the children, it's elderly people, and people who have asthma and allergies are the most vulnerable. And that's because they're the most sensitive to the changes in the environment. And they are like the canaries in the coal mine in terms of warning us of the health effects of climate change. You know, before we had air quality detection technology, miners used to take a canary down into the coal mine, and if the air would turn poisonous, the canary would die, and they would still have time to come up to breathe fresh air. But in the case of climate change, when the canaries die, we have nowhere else to go. This is our home, and climate change is polluting our air, it's contaminating our water, it's threatening our food supply and exposing us to a host of infectious diseases. So what's causing it? Oh, oops, I forgot that slide. Okay. I have that one too. Why don't you go back? Okay, that's good. There we go. So this is showing what combined sewer overflow looks like, and you can see in the first slide, the first picture, the rain running off from the street and going down into the storm drain, and then you can see in the same one that same rainwater mixed with raw sewage coming back up, and here is a particularly horrific example from Duluth this summer. And again, this is just showing the how closely rainfall and gastroenteritis run together. The black line are actual emergency room visits of children to the emergency room in Wisconsin for gastroenteritis, and the blue line is what the prediction is if that were being caused by rainfall, and you can see they pretty well match up. Mold is another health consequence of flooding, and surfaces that have been wet for 48 hours or more are very likely to grow mold. We know that people who have asthma and respiratory problems, that it worsens when they're exposed to mold. We also think that there's some early evidence that mold may also cause asthma. There is a researcher at the University of Cincinnati who has been following a group of children who are at high risk of developing asthma because it runs in their families. And he's followed them from birth up to age 7 and found that the children who were exposed to mold in the home as infants had 3 times higher rate of developing asthma by the age of 7 than the children who were not exposed to mold. Another consequence of heavy rainfall that we see is our blooms of blue-green algae, and this occurs both because of the rain and also because of increased water temperature. So when rain is running off of farmlands, it can carry with it fertilizer and manure and add a lot of nutrients to the water, and then the increased temperature and the nutrients together cause these giant algal blooms, and this is Lake Erie. In addition to just being god-awful ugly, the blue-green algae are hazardous to health. And on the minor end of things, one could get a rash or a little bit of stomach upset after swimming in water that has blue-green algae. But on the more serious end, one of the toxins that blue-green algae creates is toxic to the liver. And if it is if it gets into drinking water, we can see actual signs of liver damage when we do blood tests on people who have been drinking it. And there have been some studies done in China showing that people who get their drinking water from surface water like lakes and rivers that have had blue-green algae blooms have higher rates of liver cancer than people who do not. The World Health Organization has set some standards for monitoring and determining the safety of water with regard to blue-green algae, but the United States does not have any standards and doesn't monitor for that. So we have rising rates of liver cancer in this country that we think are probably mostly due to hepatitis C and something called fatty liver, which happens when people are overweight, but we would really have no way of detecting if it was also a consequence of blue-green algae toxins in the drinking water. So we've been talking about the symptoms of a sick planet. What's the cause? It's pollution by carbon dioxide. What's carbon dioxide? Well, everything that's alive is made of carbon. That's the building block of life. And so when we burn things that were once alive, that carbon is released into the atmosphere and combines with oxygen to form carbon dioxide. And our planet is able to absorb some carbon dioxide. Some of it is held by trees and forests, and some of it is held in the ocean. But we're currently producing twice as much carbon dioxide into the atmosphere than the planet can handle. And so that carbon dioxide, that extra that the Earth can't hold, goes up into the atmosphere and forms a blanket around the planet, trapping the heat of the sun and causing the planet to warm. Where is the carbon dioxide coming from? We're a little out of sync here. You could go to the next one. It's coming from human activity. This is a record of atmosphere of carbon dioxide in the atmosphere, which goes back 600,000 years, and it's very clear that the levels have never been as high as they are at present day. And next slide. And clearly, the United States has a large responsibility for that. This is just an illustration of the per person production of carbon dioxide, and you can see that that our country, per person, we put out much more carbon dioxide than many other countries, and especially India and China. They do have very rapidly rising CO2 emissions, but they have much larger populations, and so when you're looking at the per person numbers, it's still, we're still putting out a disproportionate share. But that also means that that's presenting us with a very good opportunity to do something about lowering global CO2 levels. So where is our carbon dioxide coming from in the United States? It's mostly from the generation of electricity and from transportation. And I always like to point out that the purple wedge, agriculture, 7%, that's where the cow farts are. So it's not really, the cows are causing some of the problem, but it's the people that are causing most of the problem. What does this mean for our future? The International Panel on Climate Change is the organization of all of the leading climate scientists from around the world, and they get together and try to understand where we are and where we're headed. And these are, they've come up with a number of scenarios, but I'm just going to talk to you about the best scenario and the worst scenario. The best case scenario, we lower our carbon dioxide emissions, the concentration of carbon dioxide in the air, you can see, stays, it levels. It doesn't go down because CO2 persists in the atmosphere for a really long time. And that explains why you can still see that the temperature continues to increase. Because we are still in what I like to call the preheat phase of climate change. When you want to cook a chicken or bake a cake, you can't just turn on the oven and put in the bird or the batter. You have to wait for the oven to warm up. And that's what's happening right now, is that our planet is still warming up. We haven't gotten to the temperature that we would stay at for the level of carbon dioxide that we have in the air. We're still in the preheat phase. So that's the best case scenario. In the worst case scenario, we continue to burn things that were once alive and release carbon dioxide into the atmosphere. The concentrations in the atmosphere continue to go up, and temperature goes up even more dramatically. Unfortunately, we are following right now the worst case scenario. And that constitutes a public health emergency. Public health, because as I've just explained to you, these are health effects that don't affect just a few individuals. These are health effects that affect broad sections of the population. An emergency, not because every person whose health will be affected by climate change is going to drop dead right now if we don't do something, but because really now is our last chance to do something. And if we do not curb our CO2 emissions and bring them down to a sustainable level that the Earth can handle, we might as well just sign the death warrants of those other people, because once that carbon dioxide is in the air, we cannot take it back out. So, shall we just have a good time now? And because it's too late to do anything? No. As you could see from those climate change scenarios, our actions will make a very big difference in terms of the ultimate temperatures that we would be seeing. And the best case scenario now, we're looking at maybe a 4 to 6 degree rise in temperature. And the worst case scenario is more like a 7 to 12 degree rise in temperature. And you can, if you think about all the things that I've told you that we're experiencing now with a temperature rise of less than 1.5 degrees, what would happen at 12 degrees is just unimaginable. So we really have to act now. And what is it that we have to do? We've got to quit smoking. We have to stop burning fossil fuels. Now, I come from a part of the country which is a big exporter of the crop called marijuana. And so when I talk about to my patients about quitting smoking, they always say to me, well, could I smoke something else? And the answer is no. Oops, I'm out of order here, sorry. Do you want to go ahead one more? And this is what happens when we continue to burn things, particularly if we burn food. And so in the United States, one of the biggest investments in so-called clean energy was putting alcohol into gasoline. And when our government set up subsidies to give farmers an incentive to grow corn to make alcohol to put in the gasoline, those farmers naturally responded to that by taking their their fields that were growing other kinds of food and planting them in corn. And that had the effect of raising the prices of the foods that they were not growing, which prompted farmers in Brazil and the Amazon to cut down the rainforest and probably burn it as well, adding to the CO2. And so when you look at the net result, including not just what happens when you set a match to the gasoline with alcohol in it, but you look at the total production consequences, we end up with more carbon dioxide release than we would have if we had left the gasoline alone. So, so growing food to burn is not a good solution. Natural gas is another example of the same thing, of the importance of looking at total production costs. This just shows the amount of natural gas released by different human activities, the percentages in the U.S. And natural gas systems is the biggest releaser of methane. Methane is important because methane is a greenhouse gas which is 20 times more powerful than carbon dioxide. And so, we look at the next slide. If you add in the methane release, and particularly from fracking, which has higher releases of methane than other methods of recovering natural gas, you can see that natural gas is no better than coal. We do know what to do. When our government unfortunately backed away from joining the Kyoto Protocol, which was the agreement that most of the governments in the world made about setting firm goals for cutting their CO2 emissions with consequences. The U.S. Council of Mayors stepped up to the plate, and so cities all around the country made those commitments. And as a result, we have been able to see the success of the programs that they've put into place. So we know what to do. About 60% of the U.S. housing stock is not properly insulated, and we lose about half of the energy that we put into heating and cooling. So we know that retrofitting buildings provides a huge savings. When you want to quit smoking, the first thing that we try to do is cut down. So decreasing the need for using fuel by insulating our buildings would go a long way. I think you skipped one. No, go back, go back. There we go. Likewise, decreasing the need to burn fuel for transportation. We need to revamp our transportation system to reflect the modern world and have more convenient and more efficient shared transportation, and also to have to use active transportation to get where we need to go by biking and by walking. And we also need to look at our communities and redesign them so that the places that we need to go for work and for shopping are near where we live, and we can get to them without having to get in a car and burn fossil fuel. And lastly, we need to get our energy from renewable sources. And we know how to do this. There are cities in the United States who have who are getting up to 40% of their energy now from renewables. Unfortunately, as a country, we have a really long way to go. I think you skipped one again. Nope, okay, maybe it's after that. There it is. We're only getting right now about 4% of our energy is clean renewable, and that the wedge says 8, but it's including burning wood and biofuels, which isn't clean. So we have a really long way to go in terms of having clean alternative energy in this country. And this is just showing that how possible it is for us to achieve those the reductions in CO2. And if you look at the very top line, that's where our CO2 emissions would be going if we continue business as usual. And then each wedge shows you how much of a reduction we get from adding together all the things that I was talking about. So if we improve the energy efficiency of our housing, if we generate our electricity from renewable sources, if we grow our communities in ways that don't require so much driving, if we put solar panels on our roofs, if we use biofuels, not the ones that you grow, but recovery from landfill and from farming, and you add all of those things together, that gets us to our goal. So it is possible to do. All we lack now is the political will to do it. And basically, you know, when I talk about this to people, the first thing that they think of is, what are they going to change in their life? Oh, I'm going to start bicycling, or I'm going to change my light bulbs to fluorescents. But when we're talking about a public health emergency, that is not going to make it. And we're talking about having to cut our carbon dioxide emissions in half by 2030. That is not going to make it. So when we have there's a difference between how we solve public health problems and how we solve personal health problems. So a personal health problem, maybe those things would work. For a public health problem, we look at it differently. And I'm going to tell you the story of a doctor named John Snow, who is the father of public health. And he lived in London a long time ago, and they were experiencing an epidemic of cholera, and people were dying. And they didn't know why. And instead of going around, John Snow suspected that it was something in the water, because he noticed that people who lived in a certain neighborhood who who are getting their water from a certain source were the ones who were dying of cholera. So he didn't go around and knock on doors and ask all those people to stop drinking the water. He went to the pump and he took off the handle. And that's what we need to do. And basically, we're not taking the pump off the handle in this country. We need to have the federal policy and the investment that do just that. We need to take our tax dollars and put them into having a big program like a WPA style program that will give people skills and put them to work, retrofitting all of our housing so that it is comfortable and energy efficient. We need to take money, our federal transportation dollars, and divert a significant amount away from our car-centric highway system and into mass transit and infrastructure for biking and walking. And we need to invest in clean energy. We need to stop subsidizing gas and coal and oil and put that money into clean alternative energy. And we need to charge so that when people do burn fossil fuels, they're paying the full price for the damage that they're causing. If we do that, in addition to not having temperatures of 7 to 12 degrees to contend with in the future, the temperature rises of 7 to 12 degrees, we will benefit right away because we know that there are big health benefits to be gained from not burning fossil fuel. If we shut down all of our coal-fired power plants, we would save 24,000 lives a year of people who are dying from the ozone and the particulates, which are really the same thing as what I explained happens when people breathe wildfire smoke, except the coal plants are pumping that stuff out 365 days a year. We would see 40,000 less heart attacks because of the decrease in particulates, and additional. And if we put our if we had clean vehicles, we would also see a drop in our cancer rate because half of the cancer cases that are caused by air pollution are caused by vehicle exhaust. We would also be healthier because of the levels of physical activity that we would have from active transportation. And we know that cities that have higher rates of people who bike and walk to work have less obesity and they have lower rates of diabetes. We know that, that people who live in walkable communities use their cars about 40% less. They're twice as likely to get recommended levels of exercise, and they weigh about 7 pounds less than people who live in more dispersed communities. We even know that mass transit is a form of active transportation because instead of taking you from door to door, people have to walk to where the bus or the train is. And an experiment was done. Not an experiment. They did a study in Charlotte, North Carolina when they put in their light rail system looking before and after at people's health, and they found that the people who became rail commuters lost an average of 10 pounds, lowered their risk of obesity by 80%. Now, a 10-pound weight loss may not be much if you're trying to, get into the genes that you had as a teenager, but from a health point of view, it is extremely significant because a 10-pound weight loss cuts your risk of diabetes, of heart disease, and of breast cancer in half. So we have a lot to gain by lowering our CO2 emissions and making these changes. So basically, we have a choice. I think he skipped. It seems like they're skipping. Can you go back? Sorry. No, it's going right from there to the next one. Nope. Go back. Okay. Well, we have a choice. We can either choose to live in a place like Greensburg, Kansas, which is a small community that got flattened by a tornado and rebuilt to be energy independent. And they will be, and they're on track for being energy independent in 2017. And you can see their passive solar school, their hospital with wind turbines in the parking lot, their public administration building, and their cultural center. And they're beautiful. They're just beautiful. Or we could choose to live in Portland, Oregon, which with a mix of biking and And light rail has incentive programs for solar panels has decreased their per person carbon footprint by 26%. Or we could continue business as usual and see that 7 to 12 degree rise in temperature, all of the illnesses that I told you about, our southwest a dust bowl, our forests scarred stumps, and extreme heat. So we really have a choice. Now, I know better than anyone probably that telling people what to do doesn't work and telling people what not to do doesn't work. And this is a lesson that I've learned from taking care of people who have chronic diseases. You know, in order to make this change, we can't, if we put it forward like we're trying to take something away from people, it's just resistance. And I think that the message really needs to be that when we do all of these things, we are going to dramatically improve our lives. We're going to be healthier people. We are going to have stronger communities, happier families, and a much higher quality of life. There you have it.
Well, I would like to ask a question, if I may.
Okay.
It's actually a story. My mother-in-law passed away over a decade ago, but when she was in her late 80s, the temperature here in Woods Hole was in the 90s for several days in a row, and she had a heart problem, and heat stress she led to her starting to fail. So we ran quickly away and got an air conditioner. And that was fine then, I suppose. I mean, with what we know, maybe it wasn't so fine. It's not simple anymore. If we just throw in air conditioners, that increases the amount of fossil fuel that is used. And so it becomes self-defeating. Is there anything you can say about maybe first commenting on this kind of situation, and second, what people can do instead of putting in an air conditioner?
Well, a couple of things. One is that air conditioners are not even a solution, because what happens is that if we're having extreme heat events, and I know this in California, this happens fairly often, everyone turns on their air conditioner, and then there's not enough electricity to power them all, and so they'll have rolling brownouts and blackouts, and then people are worse off than they were before if that's what they were depending on to keep them cool. Mm-hmm. So it's not even a solution. It's a solution. It's one of those things that it's a solution if you do it, but not if everyone does it.
Yes, indeed.
So so fans, you know, use less electricity than air conditioners, and that's definitely important to have one on hand. And swamp coolers use less electricity than air conditioners. The other thing is that we know that people accustomed to heat, and so we see most of the deaths from extreme heat are in the beginning of a heat wave, and so it is possible that we will adapt. But certainly, you know, the people who are frail and elderly are going to be very vulnerable, and I wouldn't be surprised if your mom was taking a diuretic for her heart, and that made her more vulnerable.
Yeah, that makes sense.
Yeah. So, and there's not easy answers for that.
Yeah.
Yeah.
Are there other questions?
Yeah, I think so. If I can ask one.
Yeah, go ahead.
We've been working in this town in Falmouth on climate change issues for a while now, since 2005 when the town adopted a climate plan. And as John has said in previous programs, you know, a lot of this concerns technology. But on the other side of it, there are social changes that need to take place. And with all the problems in the world today, including the economic decline and so on and so forth, there is a high level of anxiety that people feel. And that leads to medical issues. And I wonder if you have thought about this or can give us any recommendations about how we might deal with this phenomena.
Boy, I'm just a doctor.
Yeah.
I think that I really do believe that, and there is some, medical evidence to show that having people out in their communities, interacting with each other, walking around, knowing their neighbors, helping each other is psychologically beneficial. And so I think that when we move towards a society where we're having more active transportation, when our food is coming from closer to home, when we're not isolated in our house, locked onto some electronic device, that is really going to help. And I also think that, it is true that in order to use mass transit and to walk and bike, one has to slow down. I think our multitasking, high-achieving culture has not been good for us from a health standpoint. We know that there's more heart disease that's related with stress, and it looks like probably diabetes as well. And so I think that slowing down and lowering maybe our expectations down to human scale is going to be good for us in the long run. I think it's very hard for people to contemplate that, but if we all made that as a big cultural change together, then I really believe that we would be happier and healthier for it.
Thank you. We've seen a big change in the use of the bike path here in town. People really enjoy it. A lot of people use it to commute to different places to work and just for the joy of it.
Yeah.
So that's one area that we can see change there. And thank you very much for your work.
You are very welcome. I'm wondering if we can go back and